Dear friends, many of you may not have heard of fistula, or those who have heard of fistula also may not be aware of what exactly it is, because many people know about piles or hemorrhoids which affect the anal canal, but there is one more devastating, more complex disease than piles, which is known as fistula. What is a fistula? Let us see. The anal canal is about a 4 centimeters long tube. It's like an exit door for whatever you have put inside our stomach. It has to clear from that area. So there are two muscles called sphincters, two rings of muscles, which will be keeping the anal canal closed. And motion, whenever it has to pass, it will open. So between these two muscles, there are something called anal glands, which will be secreting a little secretions into the anal canal for lubrication purpose also. So sometimes motion enters into those glands, they get infected and pus will form. When pus forms, patients will start having pain, some discomfort, some sort of pain and all that in that area. Many times it will go undetected, people will miss it. Even doctors, surgeons, proctologists can miss it if it is not examined properly and thoroughly. So that is the first stage. Then what happens? Sometimes it opens inside and a little pus comes out and they get relief. Again it will happen. So they'll be getting on and off like that. Then after that, if it is not treated, so that pus starts spreading and it pierces the skin and makes holes and pus starts coming out. So it forms like a tube from inside. It forms a tube and it opens out, and then pus starts coming out. Then it is called fistula. So fistula is nothing but a anal gland infection which comes out through small holes, through small tracts or tubes, and then opens outside and pus will be coming out. So in that there are mainly two types of fistulas, simple and complex fistulas, and treatment is always surgical. For fistulas there is no medical treatment unless the fistulas are caused by some other disease like Crohn's disease or tuberculosis, hidradenitis, some other diseases which are, these are called secondary fistulas, secondary to some other disease. Then that disease also has to be treated. Otherwise, regular fistulas, normal fistulas, all require surgical treatment. There are different varieties of surgeries, including the latest, this one is addition is lasers. And guided procedures. Now we are doing what is called circumferential endoanal real-time ultrasound guided procedures, wherein we put a small probe into the anal canal, detect, correctly delineate where are the tracts, and then take care of it properly without causing any damage to the sphincters and continent mechanism. So we can improve the results by using that sort of gadgets and all. So gadgets will help us. But the principles in surgery of fistula are to be followed properly so that your patient will not get the recurrence. Again and again, patient should not be coming to the surgeon. So what is the problem with fistula? There are two problems with fistulas, which are more complex than piles or hemorrhoids. In fistula, the one is when during operation, you should not damage the sphincters too much. If sphincters are damaged, you get what is called incontinence. You lose control over your motions, gas, and even liquids. So that is one thing. Second thing is, if it is not done properly, if it is not cleared completely, you will get again and again surgery needs to be done. So both are to be balanced properly, and proper surgery is to be done. So specialized centers like ours, who have been doing for 20 years, 25 years only into this with full research-minded approach, then we'll be able to give much better results than done outside, because we have got speciality in this, and all our concentration is only how to prevent the recurrence of fistulas. So all recurrent fistulas and complex fistulas are better treated only at specialized centers. So that's why you get referrals from teaching hospitals, senior surgeons, corporate hospitals, where there are recurrences. They refer to us as a specialty center. So it doesn't mean that we are superior. No, we have got specialized in this. So we concentrate on that, and only because we have got expertise in this, we will be able to give better results for the patient. So after all, we are all there, all the surgeons, doctors which are in whole our community. is meant to improve the health of the society, in the individuals. So it is our responsibility. Wherever we have got expertise, we have to give the best for them. So regarding fistulas, fistula is not equal to piles. Piles are a different disease. Fistulas are more complex and require always surgical treatment and proper surgery done at proper time. Don't delay the treatment. Proper time, properly investigated. We do MRI, we do ultrasound guided procedures. All that will improve the results and minimizes the damage. So never be afraid of getting surgeries done, because the post-operative also it is quite smooth. Most of the people will be able to attend to their work within 2-3 days, sitting comfortably. There is no problem in sitting or traveling. All that, and unless it is a very complex, the more later you come, more problems it will create, and it will be bigger surgeries. There one more issue with the fistulas is chronic fistula. Fistula there for several years. They can even become malignant. Cancer, it can turn into malignant. Or sometimes cancer itself can present like fistulas. That also we have to keep it in mind. Very recently we had a patient from England who came thinking that it was fistula, it was operated there, but it was a cancer in the rectum. So these are all the things which we have to keep in mind when we are operating, and that's why don't delay, get it properly diagnosed and get the proper surgery at the earliest.